Hello, I am Dr. Vimala Manne, Medical Director of Dr. Vimala Skin, Hair and Laser Centers at Gachibowli and Mehdipatnam. Let's talk about dandruff today. So, dandruff is a very common condition in adolescent and youngsters. This happens because of extremely oily scalp. At this age, the sebaceous glands are very active, the secretions are very active on the scalp. So, Malassezia furfur is a yeast which grows on oily scalp and it causes dandruff to increase, and this is one major cause for dandruff. So, people who have dandruff should drink lots of water, they should avoid oily fatty foods, and they should not apply oil to the scalp. They can apply oil to the hair shafts 2 inches away from the scalp, but not on the scalp. They should also remember that never conditioners should be used on the scalp. Conditioners again should be used 2 inches away from the scalp, only onto the hair shafts. So, all these uses can aggravate dandruff, so keep them in mind. And the other causes of dandruff. Dandruff is nothing but excessive scaling of the skin of the scalp, which looks whitish in color. But there are many kinds of dandruff. Sometimes they are yellowish, they are silvery white, and so many others. So, a mild dandruff is called Pityriasporum pityriasis sicca, which is very mild and is very common. Then you have Seborrhea capitis, which is very greasy oily scalp with thick greasy scales. Then the other common condition is white silvery flakes, which is nothing but psoriasis of the scalp. So, unless you go to a dermatologist and a trichologist, they will not be able to identify what kind of underlying disease is causing the scaling of the scalp, in layman's terms called dandruff. So, please be aware of the dandruff, the different types of dandruff, what are the aggravating factors, and you can meet with a dermatologist and take adequate precautions. There will be so many zinc pyrethroin containing, salicylic acid containing, ketoconazole containing shampoos which help to control the dandruff. There are many on the counter products which help in controlling the dandruff. But what kind of dandruff do you have and which is the best treatment regime to follow? A good dermatologist and a trichologist will help and guide you accordingly. So, please take their advice and you can solve the dandruff issue. And just remember, if the dandruff is more, some people get acne and acne form eruptions, acne like eruptions called Pityrosporum folliculitis, which occurs mostly on the forehead area, on the shoulder and the upper back. And some people get white and blackish patches, which is called as different languages with different terms, like it is called as same, it is called as sebum, and so many other things. So, it is the same yeast, Malassezia furfur, which causes all these problems. So, people who have dandruff will get other problems as well on the skin. So, be aware of these conditions, and lifestyle modifications are very important, and good use of good shampoos, avoiding oils to the scalp in the adolescent age and the younger age group where the oil glands are active. Drinking lots of water, and once again I stress the importance of avoiding oily fatty foods and hyperglycemic foods, and taking a lot of fresh fruits and vegetables. Boiled non-veg is okay, like fish and egg, but avoid biryanis, burgers, pizzas and chocolate cokes. Sleep well, because late night sleeps and stress also increases the oiliness of the scalp and increases your dandruff. So, take care of all this, and if any other issues with your scalp and your skin or dandruff issues, please do visit our clinics. We are there to help you out. Thank you so much. Signing off, Dr. Vimala Manne.